Hello everybody. My name is Cameron and I've been your Aflac representative for many years. And the purpose of this video is to give you a very clear understanding of how the Aflac plans work, how they helped you, how they help your family. Aflac must be explained. I just can't give you a packet and say here. There has to be an explanation. And with this explanation, I'm going to give you a special emphasis on how Aflac helps with COVID-19 health problems. At the end of this video, you have a clear understanding and you'll be able to make a choice of what's best for yourself and your family. You should have in your email an attachment of a Word document of the summary of plans. If you have that, please follow along, take it out and follow along. If you don't, no problem, you don't necessarily need it. You also should have an Aflac interest sheet. And so if you don't have that, either reach out to myself or reach out to your HR and I'll get it to you. But those things are great to follow along with if you have them. This is just to say that I can't follow everything. Once you enroll in the plan, I'll give you a brochure with all the specific details. So let me explain how Aflac works and how it's different than your other insurance. It's really simple. It just comes down to two basic problems. If something was to happen to you, a medical problem, or if you're married, your spouse, or a child, you're going to have two problems. And one is there's out-of-pocket medical expenses that all of us deal with deductibles and copays, especially if we're talking about hospitalization or we have to take medicine. It's very expensive. The second problem is that we might not be able to work. And the last time I checked, if you can't work, you can't get paid. So in that scenario, when there's a medical problem, at the moment your income has taken a nosedive, all of a sudden you're confronted with unexpected expenses. That is the largest cause of bankruptcy in this country. So in that scenario, we go to the doctors and hospitals and our health insurance kicks in, right? But our health insurance is going to pay our bills, and going to pay our car payments and mortgages and rent payments and all those things. That's what Aflac is for. These plans are real simple. They just pay you cash after an accident or after an illness and maternity. So that cash is for you. Think of it as a safety net that comes into your hands during a very difficult time. Very important things to understand about Aflac, how it's different. Number one, the rates never increase. If you're listening to this and you already have Aflac, a lot of you already do, they just roll over automatically every year. So you don't see any rate increase year after year. Most of the plans are on a pre-tax basis, which saves you a little money. These plans are portable. You can take these plans with you. If you ever go off and move or something like that, these plans could be a part of your retirement portfolio as you go on in your years. Let me tell you, I've been doing this for a while. It's very difficult to find these plans at the rate that you're getting at them today. And they stay at this discounted payroll rate for the rest of your life. You can get direct deposit now for your claims payments. Aflac pays pretty quickly. And as I mentioned, I'm going to give special emphasis with COVID-19 coverage. These plans pay you no matter what other insurance you have. So it doesn't matter what your health insurance covers or doesn't cover. Some people ask me, what if my spouse has separate health insurance? It doesn't matter. These plans would cover a spouse regardless of what other insurance your spouse has or your kids. There are 3 plans available, and again, if you have that summary of plans, please take it out and follow along. If not, it's not necessary, but I have the rates in these slides. But think of it as a menu of a restaurant. You can pick and choose a plan or a combination of plans that best suit your needs. So you can enroll in 1 plan, 2 plans, or 3 plans, or none. Obviously, these are totally optional. But each plan has its own separate rate. So whatever plan you enroll in would be deducted from your paycheck. So let's start with the accident plan. The accident plan is extremely generous. It pays you after an accident and you get medical treatment. It could be on the job or off the job. It doesn't matter. It pays you based on a specific medical event. So each medical event has a check for you. So that, as you can see here, it's a list of medical events, and this is just the first slide, and there's a number, and that is a check too. So for example, let's say you have to go to a to a urgent care clinic or a dentist or something where you have to get medical treatment. You're going to get $125. And then there's also an ER benefit, as you'll see later on. The first day of hospitalization, which is the most expensive part of medical coverage, you'll get $1,200. for the first day of hospitalization, and then you'll get $200 for per day thereafter. So remember, it doesn't matter where the hospital is. You could be traveling in another country. It doesn't matter what your health insurance covers or doesn't cover. This is a payment to you if you are hospitalized for an accident of $1,250 for the first day and $200 every day thereafter. $75 if it's a rehabilitation unit. ICU is $1,400 for the first day and then $400 every day after. And then I'm not going to go through all of these. Here's the second slide: concussion, coma, 10,000 burns. It depends on the degree, the second degree and third degree burns and the size of the burn. Dental work, dislocations up to 3,000. It depends on which body part's dislocated. Laceration, it depends on the size of the laceration. Fractures, it depends on which bone is fractured. The bigger the bone, the bigger the check. PTSD is post-traumatic stress disorder, $200 payment. Appliances, those are like wheelchairs, crutches, and braces, and those types of things. And there's the ER benefit, $200 if you end up in the ER observation. Every time you got to go back to a doctor, like to get the stitches taken out, for example, or physical therapy, $30 per appointment. Internal injuries, $1,000. Exploratory ruptured discs, these are, again, depends on which body part has the medical problem, torn knee cartilage. Dismemberment, up to $12,500. Paralysis, up to $10,000. Death. And then there's an accidental death policy built into it. So that if a person dies in accidental death, up from $5,000 all the way to $100,000. It depends if it's a dependent. This is where the rate, the payout for a dependent is different than an adult. $100,000 would be for major transportation, like if you're in an airplane or train or something like that. Now let's talk about the wellness benefits. The wellness is something that everybody loves, and it's very often passed over. This plan has a benefit and has nothing to do with an accident, where it pays you $50 a year if you just go do something for the wellness of your body. I'm talking about physical exams, immunizations, eye exams, teeth cleanings, these type of things. $50 per person. So if you do family coverage, then that would be $50 times however many people are in your family. So that number can get pretty big if you are doing family coverage. Now, you do not get this benefit in the first year of coverage. So the first year under the plan, you're not going to get it, but after year 2 and beyond, there's a lot of you have had this plan for many years. So do not forget to file your wellness benefits. If you don't have the form to do that, please reach out to me and I'll send it right over. Here are the rates. As you can see, this is ridiculously cheap, $7 a paycheck for an individual, up to $18.44. Now, if you calculate the wellness of $50 times however many people are in your family, that gives you an idea that a big portion of the year is basically for free, depending on who you're going to cover. But you can do the math there and say, okay, if I have 4 people in my family, that's $200 a year that you're going to get back from this plan. Let's talk about the hospital plan. All right, the hospital plan is different than the accident in that it also covers illness and maternity, not just accidents. So it's based on, it starts with the hospitalization benefit, and then it has some other types of wellness and other benefits for fees. So first day of hospitalization, including maternity, is $500. And then hospitalization, it pays you $200 a day if you're hospitalized. So that's per day. So, and then it has benefits for lab tests, ER visits, x-rays, $25 to $50, it depends which one. Well baby care. So this is a great maternity plan. It pays you $25 per visit if you take a baby to a doctor for well baby. And then let's talk about the wellness. This wellness involves more for women wellness, a mammogram benefit, $100, and then a $50 per year pap smear benefit. So these are the rates. As you can see, it's also very inexpensive. If you are a woman and you calculate the wellness for mammograms and pap smears, that's $150 that you're getting back from this plan. Let's talk about the last plan, and it's one that I hope everybody listening will enroll in this plan. It's a lump sum critical illness. It pays you a lump sum between $5,000 to $50,000 if you are receive a diagnosis of one of the critical illnesses that are listed here. And of course, the first one is cancer, which is the big one, and then you could read for yourself all the others. This is really important. These kinds of critical illnesses cause a lot of financial distress. So to have a lump sum large check placed into your hands immediately following it is a huge relief. So coronary artery bypass surgery, you will receive 25% of the lump sum. Same thing of non-invasive cancer, meaning something they could just cut off, like your skin. And then skin cancer, if you formally are diagnosed with skin cancer, but it does not go internal, they just can cut it off. You get $250. Now, if skin cancer, if it goes internal, and there's scientific ways of determining that, then it becomes just a regular cancer diagnosis, and the full lump sum is paid. For example, if you have a mole taken off, and they find that there were some cancer cells, it wouldn't kick in for the full lump sum. It would do 250. But if they find it had gone internal and spread, then the full lump sum kicks in. I hope that clears that up. Really important things about the critical illness is that your dependents are covered automatically and for free for half of your lump sum. So you have to pick a lump sum between $5,000 to $50,000. So if you chose, for example, the $30,000 lump sum, then that means if you have kids up to the age of 26, they are automatically covered for $15,000. Rates are locked in at your age bracket. I'm about to explain that. I'm going to show you the rates, but the rates never go up, so I'll set that aside. Now, we have a separate rate sheet for spouse. I just couldn't. It's on the summary of plans, but if you're going to include a spouse, you have to add the rate for yourself and your dependents if you have them, and then go to the next box and you'll see the rate for your spouse. Anyone can enroll regardless of your health. So if you have health problems in the past, you can enroll. All right, let's talk about the wellness in this plan. It's a $50 for checkup per person, and then $200 mammogram benefits. So that is something to calculate when you look at the rates. It's extremely generous, so that you're going to get a lot of money back, and that would pretty much cover a big part of the year. So yearly visit, $50 per year. Now the dependents, you do not get the wellness for dependents. For this plan, only for employee spouse. Mammogram, $200 a year, so that is a potential of $300 per wellness. Here are the rates, and as you can see at the top, it says from 5,000 all the way to 50,000. You have to choose which one of those levels you want, and then find out how old, figure out how old you are, and then that would determine what your rate is. Now, it's very important to understand that, so for example, if you're 30 to 39, you're 35 years old, you want the $30,000 lump sum, that's $12.79. As you become 40, it does not go up. It stays the same forever. And that's the really cool thing about this. And then again, if you calculate in the wellness benefit, how much of the year that would cover. So how do you enroll? It's real simple. That you should have on your email an employee interest sheet. If you don't have one, please reach out to me or to your HR, and I'll send it right over. You fill in your information. You can see it's a PDF where you just have to type in your information, and at the bottom you click the box for the plan or the plans that you're interested in and the coverage. You do not need to print it out. Just click it, fill it in, click the boxes and save, and then you email it to either myself or to HR. I'm going to send you a document for your signature. Remember, that's important, that your plan is not in effect unless I get your signature on a document, and I will also send you brochures and information about how to file a claim. This is my contact information, so please reach out to me for any questions. If you don't have the summary of plans or the interest sheet, if you want to go over what the coverage you have right now, if you want to make sure you're maximizing the wellness benefits, please reach out to me by phone or by email. I'm here to help you out. If you also want some advice about which plan or plans you should enroll in, I'm happy to do that. I'm going to ask you some questions, and I'll say, well, this is your priority number 1, number 2, and number 3. But as you can see, the rates are very inexpensive, and I hope that everybody will take advantage of this. Thank you very much for your time. I look forward to seeing everybody in person someday soon, and I'll talk to you soon.